Welcome back to Workforce Wednesday, where we bring you the latest workforce developments across primary care and explore what they mean for HR, practice management, and operational planning. This week, there's a significant update from the Department of Health and Social Care that directly affects the future of our primary care workforce. The government has launched a national call for evidence to help shape a refreshed 10-year workforce plan for the NHS in England. What makes this particularly important for general practice is that GPS, PCNs, and primary care organisations are being actively invited to share their insights and experiences to influence the design of this long-term strategy. The department is not only asking how many staff the NHS will need in the coming decade, but also what roles they should play, where they should be deployed, and what skills will be essential as healthcare delivery continues to evolve. The focus is firmly on prevention, digital integration, and shifting more care into the community, core principles that place general practice right at the heart of the transformation. From an HR perspective, this is a critical moment. Workforce planners at national level are seeking real-world examples from the front line. That includes your challenges with recruitment and retention, your innovations in workforce redesign, your approaches to flexible working, and your success stories in developing multidisciplinary teams. Submissions from primary care will provide vital context to ensure that the refreshed plan reflects the realities faced by local practices and PCNs. GP leaders have already highlighted the importance of retention being given greater priority, warning that without stronger measures to support work-life balance, professional development, and manageable workloads, many experienced clinicians will continue to leave the system. HR leaders across primary care now have the opportunity to shape how these issues are addressed. For those managing teams or overseeing HR in general practice, this is your chance to ensure that your organization's experiences are heard. The call for evidence is open now on the gov.uk website, and it welcomes case studies, workforce data, and proposals for improving sustainability within the sector. If you're thinking about responding, focus on what you've learned about recruitment patterns, the impact of new roles such as care coordinators and physician associates, and any innovative models of flexible or remote working that have supported retention. The aim is to help policymakers understand not just the numbers, but the people, systems, and structures behind them. At General Practice Solutions, we see every week how dedicated, skilled staff make the difference between a system under strain and one that continues to deliver outstanding patient care. This consultation is an opportunity to make sure that voice is recognized at national level. To take part, visit the 10-year Workforce Plan call for evidence on the NHS England website. The consultation is open for several weeks, and your input could directly influence the next decade of workforce planning across the NHS. That's all for this week's Workforce Wednesday. Thank you for listening, and for everything you do to keep primary care running.